Hello and welcome back to Local Health Now with Guthrie. I'm Renata Steele and I am talking to Dr. Gavin O'Mahony, who is a fellowship trained and board certified hand surgeon here at Guthrie. Dr. O'Mahony, thank you for talking with us today.
No problem, thank you.
So we have been talking about hand and wrist issues and different types of treatment. So we're going to continue that conversation. And I wanted to ask you, as a specialist who deals with issues concerning the hand, wrist, and forearm, can you explain a little bit about how the hand works and what it's made up of?
Sure, okay. So the hand is actually a very complicated piece of biological machinery. So the basic framework is made of skeletal structures, and all of the bones are held together with strong ligaments. The motion comes from a very simple mechanism, a little bit like a puppet on a string. You've got tendons that are like the strings, muscles pull them, and they act on the bones to cause motion. Because it is a living organism, it needs a blood supply, so there are a lot of vessels in there. And because we actually experience the world through our hands, they're organs of sensation, we have a wealth of nerve tissue in the hands to enable us to feel everything we interact with.
Okay, and now one of the most common issues that people often think of concerning the hand is carpal tunnel.
Yes.
So can you explain a little bit about what this is and how it affects people's lives?
So we talk about this problem, carpal tunnel, a lot. A lot of people aren't sure what is going on there. It's really quite simple. So the wrist bones, there are 8 wrist bones, and what you don't see is that they're actually arranged in sort of a C shape, a semicircle, and over the top there's a thick ligament. The word carpus means wrist. It is actually a wrist tunnel, that's all it is. So there are 9 tendons that run through there and a thick, big nerve, the median nerve. When there's any swelling and increased pressure, the tiny little blood vessels on and in the nerve get compressed and pinched off, and the nerve starts to malfunction. It's similar to what happens if you sit in the wrong position for a while and your leg falls asleep, and it actually feels exactly the same. So if you wanted to imagine what someone else is experiencing, if they tell you they have carpal tunnel, it's that feeling in their hand all day long, which can be quite frustrating.
Okay, and now for people who may be dealing with an issue with their hand or their wrist and it's concerning enough that they think they need to see someone about it, what should they do?
Well, I would advise not waiting. It may be something that can be treated non-surgically, and the intervention may not be disruptive at all. So I would say either call us directly or have your primary doctor set up an appointment, and we should be able to see you in a variety of locations, Ithaca or Big Flats, and we'll probably be able to get you in within a couple of days.
All right, well, Dr. O'Mahony, thank you so much.
Oh, thank you.
All right, and thank you for joining us for Local Health Now with Guthrie.